está. Perdón. Solo que no vemos el audio. El audio, fíjese que el audio de la... No, no escuchamos audio. Si quiere hable por la computadora. No tenemos audio. Y no tengo interpretación, en la aplicación. No, aquí ya. Ok. Listo. Bye. Listo. Bye. Sí, no. Ahí está, ¿no? Ajá, mejor si se prende la luz. Sí, está bien. Bueno, pues así que prendemos la luz. Está bien.
There we go. Can they hear us now? Sorry. Great. Okay, so we have most people kind of in the third rung, but we have some folks who are new, some folks who are very seasoned, and some folks in the middle. That's great. Good mix of experience. And our hope today is to share a little bit of our experience, but to really learn from you and to hear your ideas. So great. So we'll expect at least 13 people, well, 17 people to have a whole lot to share. And then a lot of ideas from everyone. So great. All right, so I'll take just a minute to walk us through our objectives and agenda for this session, and then we'll get started on the interesting parts. So our objectives today really are to understand the current knowledge and research around the empowerment of women and girls through WASH, what we already know. We also want to discuss current efforts and strategies to influence stronger empowerment policies. And then we want to have a discussion around opportunities and barriers to practical implementation of gender transformative WASH. So our agenda is we'll have 4 brief presentations from our co-conveners. First, we'll have Emory University sharing, and then Global Water Challenge, and then World Vision, and then CONASA, which I meant to memorize last night, Consejo Nacional de Agua. Exactly. Yeah. I'm learning Spanish, but I may not. But our presenter is actually online with us on Zoom, Senor Pedro Ortiz from CONASA, but his presentation is an interview on video, and then he'll be with us live for Q&A. And then we'll have Q&A as a group, and then we'll have a breakout discussion. So hopefully we'll keep you energized throughout. So our presenters today are Dr. Bethany Caruso from Emory University, and then Madeline Flemick will come from Global Water Challenge to present. I will be sharing on behalf of World Vision, and then Karina Aquino, my colleague from Honduras, will be facilitating the video with Senor Ortiz from Honduras. All right, without further ado, I'll pass to Bethany to get us going.
All right, so we've added a few slides to this before we get started in the formal presentations. I'm going to go off to the side a little bit because otherwise you might not see me. So because I think that there has been some conversation already this week about gender transformative WASH and not everybody necessarily knowing what those terms are. So we just want to bring everybody up to speed so we have some common vocabulary that we can share. So we're talking, when we talk about transformative WASH, we're talking about actually this idea that is on a spectrum, and the spectrum was created by the WHO. It's been adapted over time. The spectrum it's the gender responsive assessment framework, and it's been used in many ways. So just to give you an overview of what is on this spectrum, on the far side, things that are gender harmful or unequal are things that perpetuate gender inequalities. This might be like messaging or something of the like, where women only are carrying the water around, which we've seen in some schools that we've worked in, and not having women and boys. This is harmful because it's just perpetuating that norm. Might not be intentional, but it's still harmful. Things that are neutral or blind, these ignore gender norms, roles, and relations completely. A good example of this, actually, and it's not a hidden example, is actually the JMP. The UN Women has actually put out a report. It's talking about all the SDGs that are gender blind, and SDG 6 is gender blind because we are looking at households. Households are not, they're not gendered. They're houses. So something that's gender sensitive. These are acknowledging, but not necessarily addressing gender inequality. So there's a variety of research that might focus on women, focus on boys, focus on roles and things like that. It's putting the information out there, but it's not practical. It's not leading to or resulting in practice that's changing it. Things that are more responsive or specific to gender are those that acknowledge gender norms and also consider women and men's specific needs in that process. One of the examples I like to think about a lot is the work that's done by some colleagues that were here earlier in the week on talking about what a female-friendly toilet is. That's gender specific and it's gender responsive to the specific needs of women and girls. or men, as the case might be. When we talk about gender transformative, though, these are things that actually address the causes of gender-based health inequities and work to transform those inequities, transform those harmful gender norms, roles, and relations. This is often seen as outside of the work of WASH, and there's not as many examples that I can tell you of that things that have been doing that kind of work, in part because it's not necessarily always the work of WASH alone, and it very much would require a multidisciplinary sort of angle to this. But WASH is not excluded from that, and water, sanitation, hygiene might be absolutely foundational to getting to a transformative approach. So just setting the stage, now we'll get into the presentations and hopefully all have the same angle. When we talk about empowerment, though, what we're talking about is on this side of that spectrum. Hopefully people can see. So I'm going to talk about water, sanitation, and women's empowerment, and specifically focus on key findings from a recent systematic review. So what do we know then about empowerment and WASH? So my team recently carried out a systematic review. It was just published recently, and so it's available free online to anyone. The aims were primarily to, there we were just maybe. I'm on my tiptoes. Identify water and sanitation research that engaged empowerment or related domains. I'll show you what those domains are in 1 minute. Report how empowerment related terms were used, and synthesize findings by each of these domains. And this research was part of the MUSE work, which is measuring urban sanitation empowerment. The overall goal of that specific work was to create measures and validate measures for a portfolio of scales on empowerment. And that work was funded by the Bill and Melinda Gates Foundation, and it served as the basis for those measures. So for this review, we had a foundational framework that we were working from, and a definition that we were working from. The definition was of empowerment that we were using was the expansion of choice and the strengthening of voice through the transformation of power relations so women and girls have more control over their lives and futures. There are a lot of definitions. I think the key point is that you've found your work in an actual definition and concept, and I'll get back to that also in a second. So this is the framework we came to adapt. This is the adapted version. So let me talk about, there are 3 major domains. There's agency, and this includes decision-making, leadership, and collective action. In our review, we actually added another domain, which is the freedom of movement. And that's based on other empowerment work that also includes freedom of movement in that domain. There's also resources, and this is a much bigger domain. Critical consciousness, bodily integrity, safety, security, health, privacy, financial, productive assets, time, social capital, knowledge, and skills. And then we also added this domain of privacy to that as well. And then finally, this idea of institutional structures, which includes laws and policies, norms, and relations. The overall idea here is that in order to have agency, you need to have control over resources and a foundation of institutional structures that are supporting your ability to do these things. In other words, who cares if you're president if you don't have any money and nobody wants you to be? So you're not going to be able to do anything. Okay. So what we found in the work is that there's actually a recent and growing interest in WASH and empowerment, including the subdomains. We found 257 articles that talked about empowerment or one of the subdomains at least. And this is really emergent in the past few years, with 82% of those articles since 2010 alone. But empowerment as a concept was limited and inconsistent. So overall, with these 257 articles, 133 actually used the term, because some of them might have just talked about time, for example, or safety and security or decision making, but only 17 or 7% actually defined it. So this is a very performative use of this term, and actually it doesn't really help the sector really at all to learn more about it. So what we need to do is have a more clear and consistent use of definitions and concepts when we're doing WASH research. What we also found is that there was extensive research across all of these domains. So this is here to show you just how much research we have across these domains. This is in the paper. The columns show all research related to water, then water and sanitation, and then sanitation. Each row is each one of those domains. In short, this review was actually really like 15 systematic reviews because of the way that we looked at all of these domains. And it was extremely, extremely extensive. We have lots of work out there, which is really exciting. The paper also has an entirely different part in the appendix that just focuses on what the water and sanitation work by each of those domains that were specific to and related to menstrual health. We're also finding that suboptimal water and sanitation circumstances and conditions negatively impact various subdomains of women's empowerment. So a few examples. The risk or experience of harassment or physical and sexual violence came up frequently. That's in the safety and security domain. Women reported compromised well-being, including illness, infirmity, bodily harm in various ways, whether injury or intentional harm, and that's in the health domain. Women talked about limiting hygiene, limiting food, limiting water, assaults to their bodily integrity. The suppression of urination, defecation, hygiene needs because of inadequate water and sanitation environments, also related to bodily integrity, and extensive time use and opportunity lost, so assaults to their time. Similarly, women's agency, access to resources, and prevailing institutional structures influenced how women engage in water and sanitation. So for example, women reported having mobility restrictions that prevented them from attending to their needs, participating in activities outside the home, including WASH-related activities like water, sanitation, meetings, and the like. Norms dictated those water and sanitation responsibilities, their ability to participate in household, as well as community decision-making, and also this compromised control over property, money, time, movement, their own body, impacted their ability to make and contribute to water and sanitation improvements and attend to their own specific needs. We also found that there's a lot of research on WASH and empowerment, which is very promising. But of all these 257 pieces of work, which was fascinating, there was scant research on actual programs doing anything to change this. And there were some emerging measures, but at that time, so this review is the search for this review was completed in 2020. There are emerging measurements, but none at that time looking to assess WASH and empowerment. And my team has been working with Madeline here on a measure of sanitation related empowerment. So in conclusion, sort of wrapping up what we know here, we need to be deliberate about empowerment terminology. And we also already know a lot, more than enough, I think, to act and invest and be intentional. I think it's actually almost an assault on like the field of gender and WASH in itself to say, well, how much does everybody need to know for us to actually have some investment in the programming that's needed to affect the lives of women and girls specifically. Intervention design needs to be specific and to target and address empowerment in WASH. So clarity about intended outcomes and the roles of WASH in these outcomes. We need to evaluate, iterate, and improve programs. And we need to also share learning, including what did not work, so that we can be better and to have sound measures. So with that, here's the paper. Thank you to our team. And I'm going to hand it over next to Madeline.
Everyone, my name is Madeline Fleming. I serve as the Women's Empowerment Portfolio Manager for Global Water Challenge, based in the DC area. So Global Water Challenge, having a different perspective here, is a coalition of leading organizations committed to achieving SDG 6 with a focus on equitable access for women and girls. You can see here some of our illustrative partners, including leading companies, government, academia, and multilateral agencies. Since 2006, our 50+ partners have positively impacted nearly 3 million people through improved WASH across 39 countries in Africa, the Americas, and Asia. Some of our implementing partners include World Vision, who I have the pleasure of presenting with today, Habitat for Humanity, CARE, and others who I know are also present at the conference. So through years of designing and managing WASH programming for our partners, we saw constantly that there was a strong connection between water access and sustainable development outcomes for both gender equity and broader community upliftment. As Bethany mentioned, there's a clear definition or a clear need for a definition of empowerment. Ours very much aligns with that Bethany shared. Specifically, just to reiterate, we define empowerment as making someone stronger and more confident to claim the control of their rights and their lives and their future. For women, this often looks like changing the context where basic rights and opportunities are often denied. Specifically enabling the ability to determine their own life choices, access to opportunities and resources, and means to influence social change. With all that being said, to further investigate this linkage, we partnered with the Coca-Cola Foundation, USAID, and Ipsos through the Water and Development Alliance back in 2018 to specifically understand this unique connection through our water programming with the Coca-Cola Foundation in 3 countries in Africa. One broader note is that the Water and Development Alliance, or WADA, is the longest standing USA Global Development Alliance that our team manages, and works to leverage the expertise of both USAID and the Coca-Cola system on the business front as well. So the ripple effect study was broken into 2 primary phases. Phase 1 included a landscape review of existing literature and data, as well as an analysis of the WADA, or Water and Development Alliance, portfolio. Phase 2 then focused on conducting performance assessments on these projects, specifically in Rwanda, Eswatini, and Nigeria, and included stakeholder interviews and in-country data collection. The ripple effect study identified these 8 pathways to empowerment, some that Bethany had touched upon as well, which we have deemed ripple effects of water. Here we have nutrition, education, time savings, income, safety and security, health, leadership and skills, shifting roles and norms, which is a very key one, as Bethany also mentioned. Specifically, the study identified that for health, over 88% of the women who participated reported that their household was healthier since using their improved water source. We understand this connection very clearly. For shifting roles and norms, there was a 62% increase in perceived male respect for women in communities. While the empowerment pathways were diverse, the time savings piece we identified as a cross-cutting and key enabling outcome, with over 47% of women were able to save time, then used it towards income generating opportunities, entrepreneurship, and participating in community groups. And over 90% of the women who used that same time saved then reported on having increased income for themselves and their families. With this study, we then developed the ripple effect toolkit to make the findings of the study actionable for development practitioners, with an angle to not only incorporate gender into broader WASH work, but WASH into gender work as well. That can be downloaded at the QR code at the bottom right there. So pathways in practice, specifically looking back at that time savings piece. So we incorporated the ripple effect studies into our broader work with not only private sector partners, such as Coca-Cola, Cargill, the Hilton Global Foundation, and the Starbucks Foundation. Specifically, the Coca-Cola Company has institutionalized the knowledge that investment in clean water is a force multiplier for gender equity and community upliftment. So as part of their 5x20 initiative, which had the goal to enable 5 million women across their programming by 2020, we worked alongside the company and external assurance teams to integrate the water as an asset for time savings piece into their methodology. By doing so, we were able to successfully quantify over 400,000 women who were empowered through their water programming. And I can go into the methodology a bit more if we have time at the end if anyone has questions. But essentially, as the methodology was in place, whether women had saved time, if they had received either on thought or safely managed water, and then had been accompanied with additional income generating or community participation activities. So further with this, this knowledge, we then developed the Women for Water platform under our coalition. That is aimed to mobilize collective action for to ensure that every woman and her community has water access. We currently have programming in 26 countries across the Americas, Africa, the Middle East, and Europe, not only with corporate partners, but also with others as well. And not only aiming to contribute to economic empowerment outcomes for the private sector, but also raising awareness and for the issue through brands, influencers, and consumers. Very proud to announce that we launched a partnership with Smart Water and Zendaya back over the summer, which has been really awesome. More to come on that throughout the coming months, and hopefully, I think she'd be the greatest megaphone for this issue. And then, as I mentioned, we actively aim to incorporate and advocate for gender to be incorporated in all of our water programming with our partners, specifically within the private sector. You can see many of our different project types. We're currently working on the expansion of the ripple effect study into new geographies and new thematic areas, given the new global context, specifically COVID-19 response and preparedness, mental health, and climate resilience as well. And with that, we'll just say that the Global Water Challenge, GWC, is always welcomes new partners, whether it be implementing partners or thought partners. I'd be happy to discuss our work with anyone at any point during the conference. And feel free to contact me at my email, and certainly follow Instagram, Women for Water on Instagram and Twitter to stay up to date on activities. And with that, I will hand it over to Christy with World Vision. Thank you.
Great. Hello again. Hope everybody's awake. I'm Christy Urich, as I introduced myself before, and I'm here to share about what we are trying to do at World Vision to do, as Bethany alluded to. We know enough to be implementing gender transformative programming, and we have more to learn. So we're trying to, as an organization, lean in and learn in to gender transformative and Jessie transformative WASH at World Vision. So I'm going to share about a new program we're starting that we're calling Strong Women, Strong World. And I like this picture because it illustrates the foundation of access that we're building on. At World Vision and a lot of water organizations, we've been focused on access, and that's a very critical foundation. It's also very photogenic and easy to count. And we aren't getting rid of access, but we need to do more. We need to do more to be not just sensitive, but more gender responsive and be contributing to Jessie transformative work. So I like this picture because it illustrates the foundation that we're building on. So at World Vision, we organize our WASH work in 5-year increments that we call our business plans. Our current business plan is started in 2021. And I'm illustrating this because this focus on Jessie transformative programming is really core to our strategy and our business at World Vision and our WASH programming, particularly on our second goal, which is emphasizing World Vision's mandate to reach the most vulnerable. And we aren't going to reach the most vulnerable if we aren't focusing on women, girls, people with disabilities, and other marginalized groups. So this emphasis on Jessie is really a critical part of our business plan goals and our goals as an organization. So what is Strong Women, Strong World is a program. It's a program that is focusing on the empowerment of women and girls. So rather than making a water goal or a sanitation goal the center of the program, the empowerment of women and girls is the center of the program. And it's building on the foundations of WASH and also economic empowerment. So we're integrating across 2 critical sectors at World Vision with this ultimate aim of putting women and girls at the center. We're aligning to existing core program models that World Vision has, but doing it in a more integrated and sequenced way. So rather than operating in the same area, doing a lot of things at the same time, we're really trying to do things in a very intentional sequence to maximize empowerment. We're also integrating with microfinance. Should note that. It's our 3-year startup for our first first phase, and we're focusing on 4 countries at first: Guatemala, Honduras, Kenya, and Zimbabwe. And as I've been saying, we're really hoping to, it will help us to articulate and refine our focus on gender transformative WASH so that we can align to World Vision's priorities and also do better as an organization and be able to apply learnings elsewhere in future iterations. So World Vision, Jesse, is not only a priority for WASH, it's a priority for us as an organization. So the way we articulate domains at World Vision is using similar language to what Bethany shared, but we focus on 5 domains in Jesse: access, participation, decision-making, systems, and well-being. So in our WASH programming thus far, we've done pretty well with access and participation to a good extent, but we're really leaning much harder into decision-making, systems, and well-being through this program. So I won't go into too many of the details. I don't have a lot of time, but I did want to highlight our 3 core objectives for this program and some of the outcomes we're hoping to contribute to. So our first objective in the program is improved safety and well-being for women and girls. And we hope to do that through a combination of activities that will hopefully lead to decreasing fear related to safety, helping women and girls experience an improved sense of well-being, and improved access to household WASH services. And then our second objective is around improved opportunities for women and girls. And there's several outcomes under that one, including increased gender equitable attitudes disaggregated by sex, reporting decreased time spent on domestic labor, reports of women and girls who express an increased sense of agency and self-efficacy, women and girls having their own regular income, or women having their own regular income, proportion of women and men undertaking new income generating activities. We're also focusing on schools as well to reach adolescents. So we're hoping to increase WASH access in schools, and also the experience of the school environment through improved WASH and a focus on menstrual health in schools. So we intentionally did not include any metrics around educational attainment or attendance or things like that, because we don't have a really strong education focus in this. So we're focusing on the experience of the school environment, and that girls would find it a more positive place to be. We feel like we can measure that. Our third objective is an enhanced enabling environment for women and girls. And that's focusing on project supported groups that are led by women, adolescents who report using their preferred hygiene materials during their last menstrual period, average numbers of days that's at school missed per month, and average number of hours in the classroom, to give us a sense of the impact or the association that is there. We are taking a very intentional learning approach to this, because this is a novel focus for us in some ways. And so we're partnering with Emory University as our learning partner. We're very intentionally calling it learning rather than research. We're doing that in 4 key ways, with the aim to understand how WASH and economic empowerment activities integrated in this way influence the empowerment of women and girls. So we're doing that through, your typical, we're doing some atypical questions, but doing baseline, midline, and endline surveys. We're also doing intentional formative research along the way through the program to understand some specifically defined learning questions that will be defined across countries and specific to countries. We're also with Emory doing some process evaluations to understand fidelity to the program model and how well our participants are experiencing the work we're doing, so participant satisfaction, so we can also understand the quality with which we're implementing. And then finally, of course, synthesizing those learnings so that we can benefit from that and improve our own programming and also contribute to the sector as well. So I'd say I wanted to highlight two key challenges as we're getting started here. We just started and really effectively started with field programming in April and hiring our staff. Effective program integration is difficult. Any of you who come from multi-sectoral organizations might experience this too. We do work in a lot of sectors, but we often tend to operate in sector silos or programmatic silos. And we're trying to take this program and sort of graft it into ongoing programming. And so we're meeting up with programs sort of at different points in time with different funding streams and reporting lines and priorities. So that's proving to be difficult. But it's worthwhile, but it's a challenge we're facing. And the other challenge is men. No, not really. Male engagement. Sorry, two strings of your weight. Yeah, so male engagement is definitely, as we've been doing field visits. This is probably an American idiom, but it's a tough nut to crack. So we're trying to figure out how to, I want to learn into that and apply that better through this program. So that's all I wanted to share about Strong Women, Strong World. If you have more questions, feel free to ask. And I'll pass over to my colleague Karina, who is going to talk more specifically about Honduras.
Muy buenas tardes. Gracias. Okay. Thank you, Christy, for the presentation, my colleagues too. And for highlight the challenges and importance in order to integrate the gender equality and social inclusion across programming and the sectors, especially WASH sector, and to take into account or taking into account the needs of women and girls, but the priorities of the country, which Strong Women, Strong World is implementing, which is the case of Honduras. And just to give you a little bit of context about our country, Honduras is a low middle income country, currently facing a lot of challenges. And this places us in a new scenario called multi-crisis, according to the UNDP's recent report. And this report also mentioned that this multi-crisis scenario is because we are lagging behind a lot of problems that we haven't resolved from the past, such as inequalities and poverty. And in addition, we have global challenges that you are aware, like climate change, COVID-19, and internal challenges such as ungovernability and structural barriers. So that unfortunately places in a position number 132 on the list of 189 countries regarding to this index, that Human Development Index. And this is very important to say, because if we want to tackle these challenges, we need to create a multidimensional approaches. And that is why World Vision is designed this gender equality and social inclusion approach and theory of change that as a multifaceted process that guides us and how to contribute more effectively for the well-being of the most vulnerable children, other families, community, through evidence-based transformative change. So this is important because this is the approach that World Vision has designed. Also promote a systemic integration within and across sector of organization, obviously including the WASH sector. So we know that in the same way that governments play a key role trying to achieve this shift mind and social norms and relation among the families. So that is why we invited to Mr. Pedro Ortiz, who is the Secretary General of the Consejo Nacional de National Council of Water and Sanitation from the government of Honduras. And he's going, we interviewed him. Unfortunately, he couldn't join us, but he joined us virtually. If you want to address him some questions after the video that we are going to play, please do not hesitate. So he's going to explain how these policies and plans and agenda are adapted or to the women empowerment, economic empowerment of women and girls to the national plan. So we are going to watch the video and then we go to the Q&A section. Okay.
Buenos días, ingeniero Pedro Ortiz, qué gusto saludarlo. En nombre de World Vision Honduras, le damos gracias por brindarnos este espacio que vale la pena mencionar. Esta entrevista será transmitida en un evento paralelo en el marco de la GNC Water and Health Conference que llevaremos a cabo en octubre de este próximo año. Como es de su conocimiento, ingeniero, el país está enfrentando una crisis, ¿verdad? Y no solamente una crisis, sino que las grandes organizaciones y algunos estudiosos y científicos han denominado que Honduras se encuentra en un escenario que se llama multicrisis debido a los desafíos globales como la pandemia del COVID-19, el paso de los huracanes Zeta y Iota que pues han evidenciado que existe un cambio climático que nos está afectando como país y como región, pero al mismo tiempo nos ha dejado en una posición como uno de los países más desiguales de la región y del mundo. Y pues sumado al anterior, nuestras mujeres y nuestras niñas crecen en un entorno que definitivamente es desfavorable para su crecimiento económico y social. Ante esta situación, ingeniero Ortiz, a mí me gustaría saber, y en representación del Consejo Nacional de Agua Potable de Honduras, cómo el gobierno de Honduras percibe, o de manera general, el empoderamiento de las mujeres y las niñas y sus desafíos, y también específicamente en el sector de agua.
Es un proceso, ¿verdad?, que se desarrolla para producir confianza en las mujeres, ¿verdad?, que son capaces, tanto a nivel individual o colectivo, de resolver sus propios problemas, ¿verdad?, obtener esa confianza, inclusive la autoestima, ¿verdad?, y esa capacidad de análisis y reflexión para afrontar ellas mismas o planear, priorizar sus problemas y ser partícipes de la acción. Con respecto al gobierno, a la posición del gobierno, como sabemos, se ha manifestado que si nosotros no empoderamos a las mujeres, difícilmente vamos a ir muy lento en el desarrollo económico del país. ¿Por qué? Porque las mujeres representan el 52% de la población de Honduras, ¿verdad? Entonces, si no las tomamos en cuenta, difícilmente vamos a tener un desarrollo económico. Entonces es muy importante, por eso la presidenta plantea incluirlo, ¿verdad?, el empoderamiento en la agenda nacional y que sea una prioridad de gobierno.
Muchas gracias. Y en términos de todas esas prioridades, específicamente, ¿existen acciones o existen políticas, algún marco que regule el empoderamiento de las mujeres y las niñas en el sector de agua del país?
Bueno, así tan tácitamente no, pero sí diría Honduras está lleno de normativa, tanto internacional como nacional, ¿verdad?, que toma en cuenta todos estos aspectos. El gran problema aquí está en cómo, por ejemplo, algunos convenios, cómo incorporarlos en nuestra legislación nacional, porque sabemos que requiere de un proceso tanto social como político para su aprobación. Tenemos que asociarnos con los demás sectores, ¿verdad?, y buscar un objetivo único, y tanto con la cooperación nacional e internacional. ¿Qué pasa aquí? Algunas veces no coordinamos, ¿verdad?, entonces no logramos esta sinergia. Se hacen proyectos individuales, aislados, pero no nos sumamos a ese gran objetivo que debería ser lograr esta equidad de género.
Sí, muchos puntos importantes mencionó en este momento en el marco de cómo la cooperación puede también apoyar más y alinearse a la planificación que tiene el gobierno, a los objetivos que tiene el gobierno también para poder enfrentar todos estos desafíos y ayudar más a que se cierren esas brechas de igualdad de género, inclusión social, porque el tema de agua no solamente es un tema de acceso, como usted lo mencionó, o sea, también el problema de agua se relaciona mucho con la deserción estudiantil en el caso de las niñas, porque si no existen instalaciones que tienen acceso a sanitarios, entonces las niñas dejan de ir a las escuelas también. ¿Por qué? Porque si van a otros espacios pueden verse violentadas o atacadas. Entonces esto va más allá de solamente los números y del acceso, sino de ver a la persona como un individuo que tiene necesidades también que deben ser pues las debemos de ver para satisfacer esas necesidades. Entonces, como nosotros como cooperantes internacionales, como donantes, como organizaciones que hacen la implementación de gobierno, entiendo que usted considera que deberíamos alinearnos más a las planificaciones para que podamos trabajar de forma conjunta y pues poder enfrentar estos desafíos en el país de forma conjunta.
Sí, es correcto. Eso se plantea en el Plan Nacional de Agua Potable y Saneamiento, que lo acabamos de elaborar, ¿verdad? Es un instrumento pues que guía y prioriza dónde deberíamos de hacer las inversiones. Ahí pues se considera ya este aspecto, este tema de género y el empoderamiento. Ahora, ¿cómo lo hacemos? Y eso es bueno, y me voy a referir aquí a que estamos tratando o discutiendo pues con Visión Mundial, que para nosotros es un referente en este tema, ¿verdad? Nosotros en el país ya tenemos bastantes años de estar trabajando con género en agua y saneamiento. Ahora, ¿cómo lo hacemos? Y con esa visión, nuestro propósito no es llevar una infraestructura como algo, una obra fría o gris, no. Nuestro propósito es ir más allá, comenzando primero con el empoderamiento precisamente de la mujer. ¿Cómo abordamos nosotros la intervención? Bueno, es de una manera participativa, llegamos a una comunidad donde vamos no como expertos, sino como facilitadores, ¿verdad? Aplicamos una técnica que nosotros decimos SARAR, en la cual identificamos los problemas con ellos, nos sentamos con ellos a hacer la planificación, ellos identifican sus propios problemas, hay una técnica que se llama árbol de problemas, ellos analizan, reflexionan sobre esos problemas y luego participan en la acción, son ellos los que realizan estas actividades. Ahora, todo este trabajo con la comunidad los va empoderando, va creando confianza en ellos y después ven que son capaces de resolver cualquier tipo de esos que ellos plantearon en esa matriz de problemas. Ahora, nosotros, como sabemos, nuestro trabajo, diría yo, estamos primero cumpliendo con un derecho humano fundamental, como es el agua y el saneamiento. ¿Cuáles son las ventajas de que una comunidad tenga agua y saneamiento? Especialmente para las mujeres. ¿Quién acarrea el agua en el nivel rural? Caminan horas para proveerse, algunas veces kilómetros. ¿Quién hace esta actividad? Las mujeres, los niños y algunas veces los ancianos. Tienen un riesgo pues, en este trayecto de acarreo. Como usted lo decía, ahí pueden ser violentadas más las mujeres y las niñas. Entonces consumen una cantidad de calorías importantes por proveerse de esta agua. Entonces estamos, al ponerle una llave en la casa, estamos dando calidad de vida, lo que es el liderazgo, lo que es el emprendedurismo, y todavía van más allá, facilitan algunos préstamos para que puedan iniciar ese emprendimiento. Esto es muy importante, ¿verdad? Porque una de las cosas que la mujer sufre es por esta dependencia económica que tiene la mujer. Esto la libera, pues, y puede tomar algunas decisiones al tener estos recursos, algunas decisiones propias, ¿verdad? No con suma independencia.
Muchas gracias, de verdad que ha sido tan interesante lo que nos ha expresado con respecto a estos grandes desafíos y problemas que tenemos en el país, y que no solamente quizás en el país, sino también de forma regional, y el saber que de alguna forma World Vision Honduras ha estado colaborando también para ese desarrollo individual de las mujeres y las niñas, su empoderamiento para que podamos apoyar a cerrar esa brecha de género y también de las desigualdades. Pues estamos llegando ya al final de esta entrevista, ingeniero. Agradecemos inmensamente todos los aportes que nos ha comentado en este momento sobre los desafíos del país en materia del empoderamiento de las mujeres y las niñas en el sector de agua. Y quisiera saber si tiene algún mensaje final, aprovechando este espacio, que tenga para los donantes, los cooperantes, en el marco del empoderamiento de las mujeres y las niñas.
Sí, bueno, primero agradecerles por la oportunidad, ¿verdad?, que nos dan de explicar un poquito nuestro trabajo, cuál es lo fundamental de tener agua y saneamiento. ¿verdad? Sí, yo quisiera aprovechar, como dice, la oportunidad para hacer un llamado a la cooperación, que nos apoyen, ¿verdad? Realmente, como sabemos, Honduras es un país todavía con mucha pobreza, ¿verdad? Hay muchas limitaciones, como sabemos, en salud, en educación. No podemos hacer las cosas a la carrera, ¿verdad? Es mejor tomarse su tiempo. Eso me gusta a mí con sus programas, porque ustedes permanecen un tiempo ahí. No es que hacer un proyecto algunas veces toma, si somos eficientes, 6 meses, 1 año, pero de ahí nos vamos y listo. No, ustedes quedan un poco más ahí tiempo, ¿verdad? Dándole seguimiento a esos proyectos, monitoreando si se cumplieron los objetivos. Entonces, durante este acompañamiento la comunidad va creciendo, ¿verdad? Los acompañamos un rato, no estamos cumpliendo el objetivo fundamental, que es mejorar la calidad de vida y la salud de la población. Así que muchas gracias por esta oportunidad.
Muchas gracias a usted por este espacio y por este mensaje tan fuerte, tan importante que ha dado de parte de Honduras, del gobierno de Honduras a la comunidad internacional. Gracias.
Gracias. All right, maybe our presenters could maybe have us sit up here for just a few minutes of Q&A before we go to a breakout. That's all right. There's some for the background here, but it's all right. That slide for now. Actually, the screens are duplicated. You're going to see everything I do. So. All right. So, yeah, we want to take a few minutes just to give you the opportunity to ask questions of any of the presenters, and then we'll have some breakout time for that. Any questions? Well, I don't know if it's going to work. Let's. Oh, and we can invite Senor Ortiz can turn on his camera if he wants. There we go. We see you. Sort of. Not be responding here. All right. There we go. Yeah. Thank you. This on. You'll have a little microphone.
Hi, thank you. Rebecca Evans from Warwick Medical School. I think probably for Bethany as an academic, I wanted to ask 2 related questions really. This, something like empowerment is quite a difficult thing to define, but also then a difficult thing to measure and monitor. And I was just wondering what indicators you were thinking of using. And also, I was related to that, I was thinking that how long are these studies going to be continuing? Is there any thought of carrying out longitudinal studies? But how long are you expecting it to last to see an effect in empowerment?
And we can take a couple of other questions if there are, and then we'll. Sorry, what? All right.
Thank you for the question. Yes, it is difficult to define. And so that's why we did not go about, it's a mix between not being able to see when they're on and off because of the mask. It is difficult to define, and we didn't want to be in the business of creating a definition for empowerment, but to go off of a pre-existing framework. What we did is that framework document that we have that was created by others, and the definition itself and the framework, there were definitions for each of those domains for empowerment in general. In the process of doing the review, we revised or adapted those definitions to be specific for water and sanitation for that purpose, which would ground then our later work on measurement related to sanitation. Because again, for every measure, you really need to know what you're trying to measure. And so a definition and a starting point is really the first task. And I think sometimes people forget that. They're like, I'm going to do a survey and like, these are all the things I'm interested in, which is great. But if you don't know what you're going to measure from the outset, you're going to measure anything. You're going to get somewhere, but it might not be where you intend to go. So that was the first step for us. And that was our sort of adaptation strategy. So as a result, the measures that we've created now, and we focus only right now on sanitation, use those definitions that we created backed by that review to look at each one of those domains and their scales. So there's often multiple items for each of those concepts around, for example, time, or safety and security, because there's multiple aspects of safety and security to be thinking about. For example, decision-making, there's community decision-making involvement, there's household decision-making. So we tried to be sort of, in creating these measures of empowerment, one of the things that we did that's divergent compared to other measures of empowerment, some people might be familiar with something called the WEA, which is Women's Empowerment in Agriculture Index. That is a 50+ item sort of measure of empowerment that is huge and a beast to use. We were very deliberate about saying each one of these modules you'll be able to use by yourself, and it's going to be a limited number of questions, because all of these programs are not going to go about and say, we're going to just do empowerment and everybody's going to be blanket empowered. They're going to say, you know what, the biggest issue here is time, or the biggest issue here is, security, or the biggest issue here is decision-making. So we're going to do the baseline, figure out the priority, and then measure that and try to have programming to improve that thing. So I hope that's useful. In terms of the indicators and measures useful for research and other things. Sometimes they'll be useful for indicators. In a different project, working with Christy and Rick, I saw back there from JMP, we are doing work with the JMB to help identify gender-specific indicators. Some of that work might lead into this, but some might not be. The assessment of what indicators to prioritize, though, is not up to me. We're trying to have a consultative process for people to be involved in that process for identifying priorities and how to measure that. I hope that helps.
Other questions? Yes.
Can we ask questions to?
Yes.
Okay.
Yes.
Everyone's
Or
okay.
we can have a turn, David and Booker.
Okay,
I'll
slowly, please.
Or-
I'll do it in English and Spanish, but yeah, so 20 years ago, I lived and worked in Honduras as a Peace Corps volunteer in rural areas developing wash systems. And back then they required that, I think it was 2, but of a community water board, they required, I think, that 2 of them be women. And so my question for the engineer is if the new government in their new framework, I'm wondering, beyond simply requiring that 2 people are on the boards, the local community water boards are women, or what are they doing to kind of really involve them in that decision making and empowering? So gracias, ingeniero, por estar con nosotros hoy. Tengo una pregunta para usted, que yo fui un voluntario del Cuerpo de Paz hace 20 años en Honduras, en el área de Olancho, desarrollando proyectos de agua potable en comunidades rurales. Y en esa época requerían que 2 personas del comité de la Junta Directiva de Agua en las comunidades eran mujeres, ¿no? Y yo no sé ahora si ese todavía es el requerimiento, pero quería ver qué están haciendo ahora para ir más allá, que simplemente requerir que estén involucradas, pero realmente tengan el poder y la agencia para hacer decisiones. Gracias.
Sí, en este momento siempre estamos trabajando en lo mismo, ¿verdad? Que las mujeres integren, ¿verdad?, todas estas organizaciones comunitarias. Según la ley debe ser en un 50%. Y no cualquier puesto, sino que asuman puestos de toma de decisión. Entonces se está trabajando y hemos avanzado mucho en eso. Por ejemplo, ya tenemos mujeres que son tesoreras, ¿verdad?, o son presidentas del voluntariado. Entonces sí estamos encaminados a eso y cumplir la ley que manda pues que el 50%, demos el 50% de la participación a las mujeres.
Gracias, voy a pasar. Well, Mr. Ortiz said that the government already has a law, and the participation of the women has to be the 50% in the water boards, and they are advancing this in this topic, but not just to achieve the participation of women, but the decision making. I mean, to have women in the main roles of the water birds. And this is the law said that is the 50%.
We'll take one or two more questions, and we'll go to breakout.
Thank you so much for your presentation. I really enjoyed hearing about your work with women in environment. And I was wondering if y'all have done any work with empowerment for trans people, non-binary people, or other members of the LGBT+ community, or if you're planning on to do so in the future.
I can maybe speak on behalf of World Vision, and then Madeline and Bethany, well, you can too, actually. So for World Vision, our focus right now is primarily on women, girls, and people with disabilities in these focal countries. Again, we're starting out in a sense with this, so I can't give tremendous detail to that at this time. Do you want to add anything for Honduras? Okay, maybe Madeline, and then
Sure. Just echoing Christie's sentiments, with our work with women and girls, we don't, obviously, it's not limited to those who are assigned at birth. Obviously extend to anyone who identifies as a female. In our work, we don't only do water access, we also do broader empowerment work. And so one program that just comes to mind was with the Ford Motor Company in India, and specifically worked to work with mobile clinics and provide healthcare access to those really marginalized communities to have, health support. And we've heard from, those projects that those who are really hard to reach in marginalized communities, such as trans individuals, really benefit from some outside support, such as mobile clinics that come in externally rather than the pre-existing facilities that currently exist within the communities. So just one example, but in all of our work, always working on expanding maybe the norms and shifting them where needed, but obviously that takes lots of time. And but yeah, really trying to work on the destigmatization of not only menstrual health, but also, traditional gender norms and concepts of gender identity.
I don't have much to add, except that, we will be working with Christy and Karina and World Vision and see what we might find in the different communities. I think from a research perspective, one of the things that's consistently challenging is that in some locations, simply identifying as trans is very risky. And so from a research perspective, engaging people can be harmful depending on where it is. I think this is a huge issue even in the United States. So I think it raises some good questions. And then I just wanted, I don't know if Kavita from IIHS is here, but the Indian Institute of Human Settlements, Kavita and her colleagues are here. They presented on Monday regarding their work with third gender in India, specifically related to sanitation and sanitation workers. So if that's of interest to you, I would highly recommend connecting with her.
I think for the sake of time, so I want to hear from you also. I think we'll move to our breakout time. I did want to say thank you. Muchas gracias, Ingeniero Ortiz. Thank you for your time. My terrible Spanish. We're really grateful. And to you, Karina, as well for facilitating that video. That was really great. Muchas gracias. All right, so I'm going to put up some questions and avoid spinning through these slides in just a moment. Don't peace out during the breakout, everybody. No, I don't. We're not going to.
Christy, can I just add something while you're both about the question that you just asked? And we get that question. World Vision is a faith-based organization, so we get asked that question from time to time. And for us, it goes back to this question of being committed to the most vulnerable. And it's caused us to rethink very carefully how we go about identifying the most vulnerable in the communities that we serve. And I think where you mentioned that, I think in the past, we have had preconceived ideas of who the most vulnerable people are. And as an organization, we're in the process of asking ourselves, how do we identify who the most vulnerable are in the community? And I think you certainly touched on a huge need, or on the floor.
Ray is our global sector lead for WASH, so I should have passed that question to you to begin with. All right, so we're gonna invite everybody to split into maybe groups of, small groups, 5 to 6 or 7 people. And we'll disperse ourselves to help support the groups. And we have 3 questions we'd like to invite you to discuss for the next 15 minutes. If you can assign someone to keep notes, that would be great, on a piece of paper, or you can email it or whatever. So we would like to see your detailed responses, but of course, during report out, you'll only have time to pick 2 things that you want to share with the group. So we would like you to discuss 3 things. What are the practical challenges or barriers that you've experienced or seen or heard about this week to gender transformative WASH programming, and how can we address them? I think some of it has already come out in some of the questions, so I think we can further explore that in groups. Second, we'd like to hear, what are current promising practices that you know about for gender and social inclusion in WASH? So what are you doing directly? What have you heard about that could add to this conversation? And then finally, what are opportunities moving forward that exist that may not be happening yet, that we could learn into to practically implement GESI transformative WASH? So we want to start with the challenges, but build toward the positive opportunities. So so it's 2:35 right now. So if I can invite you for the next 15 minutes to sit in small groups, assign a rapporteur who will pick 2 things to share back with the group very quickly at the end.
So one of the things that was so striking, we're including more conversation. Okay, this is something like this. Go together and also go to the university. We should have a lot of general policy, we have these kind of balconies, so this, we have. Are addressing the ordinance and that's, is it like an agenda we're watching it out? I think there's not a phone where you're in there, I mean, great. It's never general. And you don't want to know women, but it's the what happens in men. But the trade and the rest of them. Really, yeah. And I find it very much because as I talk about Carolyn household service. And see the man really. They want things.
And this is, we are,
JC, they talk about LGBT.
yeah. Yeah. So the one that our page and because like president for education we have no where they can call it global and that Norman about to the government. Have economic empowerment, for example, and then we go on. And then we say, women, men, I don't going to let you go on. So we have to work for it. And that is why the more engagement and all.
Like milk checklist.
We don't know the country, like that. But it's not yet.
Because that's what we have been very, especially in the remind us, there is like the leaders. And if they carry a profit of course, that's things like once we this once is like. But it's changing so much.
My colleague has not a lot to write question number one. I wanted to add, which I think is complementary to what we're talking about. I think one of the large is all that. We'll settle the target of each one. Say, let's do that specific, and I think we'll help be, but. To be. That would be like. Like social media, I think we're talking about. So like, no, it does. I mean, we did in school, I do work in the workplace, and we had a choice to go with working with. We had a choice to go with working with older women
or we had a choice to go with working with the whole community at large. And in order to achieve, I won't say we achieve norm change, but we certainly achieve behavior change. And we laid the need for norm change by engaging the community holistically, with male engagement, the leadership on the faculty that we were with government, you know, all different sectors.
You're saying you're doing the normal, you're not bigger house, sharing chores, and it goes beyond more space, right?
Yeah. We don't have the.
No, I think we agree on
Norm change is a foundation. Whether you're talking about norms are pervasive and those that everybody needs to talk about. I don't think it's an in or out issue, not that it's outside of what it is. We are humans, we approach things based on what we think, what we believe, what we used to, how we interpret information, what our parents have taught us, what our neighbors are doing. So I think it's actually very integral in all of our, whether we're the WASH conference or the health conference or anything. So yeah,
and it's put this question to you, as you might know, it's but is there a danger of colonialism? We know this is best for you. I'm doing it our way. You know, their culture, you know, it's not something completely different to ours, or is it not their culture? I mean, is that a tension?
yeah. That is definitely all we have. I have a and one yeah. Yes, and then you're going for more with the graphic radio, with the are working like that. They can be so yeah, like work, and then and I she was thinking about how they to promote herself to these water and arts things and then that I say so there's a lot of challenges with but we are because one is that we're very proud of that anywhere that we work. But that's something not at the same time. I need to remember around the US. One is that a lot of the countries that we work in,
Yeah, and for division about private better and. There was a question about the area. On the quality, then let's just like you know, women. Challenge that now almost like right now we're saying we're keeping our hands off. That's not what now. Getting cultural for instance, very matriarchal. Yeah, matriarchal. We are now discussing with inside the issue about and that's easy. And we want so what we are doing we have slowly developed. Yeah. It's not being okay, we build but then I've seen that again. Yeah. They want to see program and they have the culture. They don't go home. All right, everyone, let's come back together.
Stay where they are. They can stay where they are.
Yeah, stay where you are. And let's, which group wants to volunteer to go first? So maybe we can start from the group in the back. And we have just a few minutes left, so we'll just start with each group sharing 2 points. But if you did take notes, please do share. I personally want to look at everything you shared. I think we would all like to learn from you. So, okay. Yeah, Bethany will pass the mic.
Yeah, we are not going to solve it. But we had such an interesting discussion around decolonization and the gender concepts around that. And well, one of the things we discussed is, are we not trying to, with JC and gender being gender transformative, are we not putting on Western norms on different communities? But we have also said, no, that's not what we're doing. We are really looking, we are supporting change from within. And we also see that sometimes it might actually be the Western concept that we brought that caused the patriarchal society. So we should not, there are so many other societies too where we can support this transformation of change. So it was really interesting. Yeah. With us from Honduras, and she explained it very well.
That's good, thank you.
Yeah, so I'm doing a bit smaller points, but two things that we talked about. One, in terms of challenges, going off of what you shared of male engagement, really kind of dug into that and just more generally power dynamics of communities, whether that's men or women, and who's, if you need, we have an example of needing to go to community leaders, not specifically going to households, depending on where you are. And then one opportunity, we talked about how new technologies in other WASH areas often don't present data. They only present data on use, but not necessarily specific to gender. So there's an opportunity there for those in academia and elsewhere to provide that data and information to then help with some of it.
Okay, unfortunately, I'm speaking for women.
With what?
Yeah, should have spoken for themselves, but I will be for them. But, okay, one of the issues which came out strongly is linkages to land tenure, where we are not only talking about drinking water, we are talking about productive use of water, where we need water for agriculture, and also even access. When you need water connection, you need to have documentation. So if you don't have land tenure document, you are likely to face damage of water access. So that's one of the challenges. In terms of promising practices, you find policies. Many countries are including policies in learning, and this is an encouraging because, like, for instance, for my country, you find any appointment in government positions, cabinet, or any appointed position. It's a total gender role where you can't have more men or women in any organization. So this policy is empowerment to gender mainstreaming in WASH. So yeah, that's what we talk about. In addition to some of what our colleagues have talked about, data, lack of data, cultural norms. Thank you.
But things I remember from our conversation that were really impactful. You mentioned your experience with schools and really implementing from a young age how both boys and girls can do these tasks that have to do with WASH, and trying to have that transformative action early, because sometimes it's a little harder when they get older. We also talked about Indigenous communities and how culture is really important there and has to be taken into consideration. Female as possible. We also talked about menstrual health and how that's really important and sometimes, a lot of the times, overlooked. And how can we really engage men in this conversation, to not only just open their ears, but also to actively engage, and really acknowledge how patriarchal structures not only affect women, but also them and their livelihoods like that.
Thank you, everyone, for your wonderful thoughts and contribution. We didn't miss some groups. I think there were 4. Okay. Well, we just have right on time. We'll be well done. Thank you for getting, at least I think, I don't want to speak on behalf of the presenters, but I guess I'm going to. You got our wheels turning. I think, I know I took a lot of notes, things to think about as we're getting started in the program. We're working on together with Emory. I hope we'll be back at future conferences to talk about this more with you, so we can learn together. Any final thoughts on behalf of any of my co-conveners? No,
Thank you. Really great engaging discussion.
yeah, thank you so much. We really appreciate you. End of the conference.
Alan.